Remote collaboration and evidence-based care. A pleasant day to all of you, my dear colleagues of the nursing profession. I'm Kari Kakinuma. I'm ICU nurse and I'm happy to be with you. First, let me thank the member of the committee for allowing me to present this paper with regard to improving outcomes for our patients. This is an important activity that is focused on our continued role of professional nurses in ensuring the patient receives only the best care from all resources available through continued collaboration from everyone. In this time of the pandemic, no matter how difficult the situation may seem, it is still important to bring together the best team that will help provide excellent, unparalleled service to our patients. Honorable member of the nursing profession, I'm going to share with you, dear member of the nursing profession, my colleague, we hopefully reinvigorate our practice towards better and comfortable nursing care to our assigned patient. It is hoped that we also share our insight with regards to what I will share to all of you. Let me begin by telling this has been thought about many times to consider only the most important yet beneficial for our patients. One very important strategy to improve patient outcomes and improve safety is the application of patient engagement. According to Sharma, 2017, patient engagement is described as active partnership between the patient, the families, and caregivers working collaboratively to improve healthcare delivery. In addition, patient engagement can be adapted at the individual level, clinic, or organization. Remote collaboration and evidence-based care. A pleasant day to all of you, my dear colleagues of the nursing profession. I'm Kari Kakinuma. I'm ICU nurse and I'm happy to be with you. First, let me thank the member of the committee for allowing me to present this paper with regard to improving outcomes for our patients. This is an important activity that is focused on our continued role of professional nurses in ensuring the patient receives only the best care from all resources available through continued collaboration from everyone. In this time of the pandemic, no matter how difficult the situation may seem, it is still important to bring together the best team that will help provide excellent, unparalleled service to our patients. Honorable member of the nursing profession, I'm going to share with you, dear member of the nursing profession, my colleague, we hopefully reinvigorate our practice towards better and comfortable nursing care to our assigned patient. It is hoped that we also share our insight with regards to what I will share to all of you. Let me begin by telling this has been thought about many times to consider only the most important yet beneficial for our patients. One very important strategy to improve patient outcomes and improve safety is the application of patient engagement. According to Sharma, 2017, patient engagement is described as active partnership between the patient, the families, and caregivers working collaboratively to improve healthcare delivery. In addition, patient engagement can be adapted at the individual level, clinic, or organization.